basically, one of the goals of teleophthalmology and telemedicine in general is to take the healthcare from an office-based element to the community. So in that regard, you can immediately see how it could address some health disparities, because you're taking specialized medical care, in the case of ophthalmology, ophthalmic care, to the community. And as part of what I do at Rutgers University, we've had an outreach program for telemedicine and teleophthalmology through partnership with a medical school, where we run these specialized eye screenings in the community, in like soup kitchens, community centers, churches, mosques, temples, schools, where an ophthalmologist located remotely at the medical school, and then a team of medical students together with other healthcare providers would be on the field, talking to patients, obtaining history, collecting data on an intake form, then checking vision, checking eye pressure, taking pictures of the front and the back of the eye. And all of that data is relayed to the ophthalmologist at the medical school, who can then make a diagnosis and a recommendation. And the recommendation typically would be either, you're good, see you in a year, or you need to come in within the next 3 to 6 months, for example, in early diabetic eye disease, or you need to come in within the next 4 weeks because you have a problem, and it could be a blinding problem. And that's how, one application of telemedicine can be in terms of patient care and addressing disparities. Let me start with the emergency rooms. And in ophthalmology specifically, this is a big problem, because a lot of the hospitals in rural areas, or even in urban areas, that are not like level 1 or 2 trauma centers, smaller community hospitals, for example, do not have ophthalmology coverage. And then when you look, it's not a small proportion of patients that go to the emergency room for eye-related problems. So what often happens in these cases currently is these patients are told, we have no ophthalmology coverage, go to Dr. Smith on Monday. So that's how they manage it. Or this seems like a serious problem. We're going to put you in an ambulance and transfer you to another big hospital where they have ophthalmology coverage, which obviously is not ideal. The care is not acute. Then you have to arrange for a transfer. It's costly. And the care is often delayed in that regard. So teleophthalmology can have a very good application through the emergency room. And we, at our medical school, we have piloted a project where we have a teleophthalmology station in the emergency room, where I work with residents, where residents would evaluate patients and take specifically OCTs, which is optical coherence tomography imaging of the front and the back of the eye, together with pictures of the front and the back, and relay that to a remote physician. And that has been proved to be very useful and helpful. Of course, there are obstacles to, for example, HIPAA, communication bandwidth, how much images can you transfer in real time quickly, medical legal considerations as well that come into play when you're talking telemedicine. So we have quite a few hurdles in terms of to overcome until this becomes mainstream practice. And if you look at the American Academy of Ophthalmology, and we're talking about the AAO meeting, there's been a task force to specifically address the policies regarding telemedicine, reimbursement models, all of these things that still have to be worked out before having telemedicine really being applied more broadly. In terms of pre-op and post-op care, this is I think this is a touchy issue, particularly when it comes to surgical care of patients. And currently there's in terms of evidence, there's very little evidence that on telemedicine and preoperative or postoperative care. This is still one area in medicine where we still do face-to-face. Now, in terms of research, there's quite a bit of research on robotic surgery being performed remotely, and not just in ophthalmology, but also in other fields like urology. And I think that area is very interesting and still needs to be explored. We're not there yet.